Good morning, Graham Mills. I am Mihiraa. Let's start the warm-up sessions. Why did you choose to become a nurse?
There are several reasons why I chose nursing. First of all, many of my relatives are nurses and their stories inspired me a lot. Besides, nursing is a profession with an ocean of opportunities, both native and abroad. Above all, this is a service-oriented profession in which I can serve humanity. Hence, I chose nursing as my career.
What are the different roles of a nurse?
A nurse plays different roles in her profession. The primary role of a nurse is a caregiver. Apart from this role, she functions as a mediator, advocate, counselor, educator, and the like. A nurse plays a very crucial role in the healthcare system, connecting various departments in the industry for the welfare of patients.
Tell me a quality that you possess that suits your profession.
I think I have excellent communication skills which help me to interact with my patients professionally. Apart from this, it also helps me to maintain a good relationship with my colleagues. So I think this is the one quality which suits my profession.
Do you think nurses should attend continuous nursing education?
Yes, I do. The continuous nursing education program helps nurses to update themselves with the current practices in their profession. Moreover, nowadays it is mandatory to have specific hours of continuing nursing education to renew the nursing registration. Hence, continuous nursing education is very important for nurses.
How do you deal with someone who isn't satisfied with your patient care?
When faced with a dissatisfied patient, I assess the issue, determine if it's something within my control to correct, address their concerns, answer their questions, and collaborate with colleagues for alternative solutions if necessary. My goal is to accommodate the patient without compromising their care.
You can now start your OET roleplay.
Mihiraa, well, I've just completed your examination, and I noticed that your blood pressure is a little lower than usual. This condition is known as hypotension. Do you have any particular concerns or questions?
What does it mean? I'm feeling all right, just a bit tired lately. Is it related?
Mihiraa, hypotension means that your blood pressure is lower than what is typically considered normal. When your blood pressure is low, it can result in reduced blood flow to your organs and tissues. This might cause symptoms like dizziness, lightheadedness, and feeling faint. Feeling tired, as you mentioned, can also be related. I understand that this might sound worrying, Mihiraa, but please don't be too alarmed. Hypotension isn't always a cause for concern. Many people live with slightly lower blood pressure without any serious problems. However, it is important to monitor it regularly to ensure it doesn't lead to any significant issues. We'll keep a close eye on your blood pressure, and there are simple lifestyle changes we can discuss to help manage it.
Yes, I have felt a bit dizzy at times, especially when I stand up quickly.
That makes sense. There are several factors that can contribute to low blood pressure. Could you tell me a bit about your lifestyle so we can identify the possible cause?
Well, I've been really busy at work, so I haven't been eating very well or exercising much. And my sleep has been quite irregular as well.
I understand, Mihiraa. Life can get very hectic, and it's easy to let healthy habits slip. But taking care of your diet, exercise, and sleep is really important, especially when it comes to regulating blood pressure. For your diet, try to include a variety of fruits, vegetables, whole grains, and lean proteins. Make sure you're eating regular meals and staying hydrated. Sometimes a bit more salt in your diet can help with low blood pressure, but we should be careful with that and discuss it further with our GP. In terms of exercise, even small amounts of regular physical activity can make a big difference. Aim for at least 30 minutes of moderate exercise, like brisk walking, most days of the week. Finally, getting enough sleep is crucial. Try to establish a regular sleep schedule, aiming for 7 to 9 hours of good quality sleep each night. If you can, create a relaxing bedtime routine to help you wind down. I know it's not always easy, but making these changes can really help. How do you feel about starting with these steps?
I understand. I realize I need to make some adjustments to improve my health. I'm committed to making it happen. Is there anything else I should take care of?
That's fantastic to hear, Mihiraa. It's great that you're committed to taking charge of your health. Making some lifestyle changes can definitely make a positive difference. Now, while low blood pressure isn't always a major concern, it's important to be cautious of certain symptoms. If you experience any worsening dizziness, especially when standing up, or if you faint, that's a sign you need to seek medical attention right away. Additionally, any chest pain, even mild, should prompt you to see a doctor immediately. Remember, prioritizing your health is key. By being mindful of these symptoms and making those positive changes, you'll be well on your way to feeling your best.
All right, I understand.
I recommend scheduling an appointment with your GP to discuss your blood pressure in more detail and to determine any further steps. They can provide more personalized advice and monitor your condition closely. Do you agree to make a GP appointment?
Yes, I think that's a good idea.
All right, Mihiraa, let me summarize our conversation today. We've discussed that your blood pressure is lower than usual, known as hypotension, likely influenced by your busy work schedule, irregular eating habits, lack of exercise, and disrupted sleep patterns. We've talked about the importance of improving your diet, incorporating regular exercise, and prioritizing better sleep habits to help regulate your blood pressure. You've expressed your commitment to making these changes, which is fantastic. Just remember to monitor any symptoms like dizziness, fainting, or chest pain closely. If any of these worsen, don't hesitate to seek medical attention promptly. I recommend scheduling an appointment with your GP to further discuss your blood pressure and to ensure we're on track with your health goals and you have agreed to have the consultation. In the meantime, try to follow the lifestyle changes we discussed. If you have any concerns or notice any significant symptoms, don't hesitate to seek help.